Right now, there are dozens of states that are having COVID case numbers spike across the country, but Michigan is by far the worst. Still, though, even in light of that, today the White House confirmed again that they're not planning to send an extra allocation of vaccines to Michigan. That is what Governor Gretchen Whitmer is asking for to try to get Michigan's crisis under control. The White House says they will send other resources to Michigan to try to help, but not additional vaccine supplies.
When you have an acute situation, extraordinary number of cases like we have in Michigan, the answer is not necessarily to give vaccine. In fact, we know that the vaccine will have a delayed response. The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down, to flatten the curve, to decrease contact with one another, to test to the extent that we have available, to contact trace. Sometimes you can't even do it at the capacity that you need. But really what we need to do in those situations is shut things down. I think if we tried to vaccinate our way out of what is happening in Michigan, we would be disappointed that it took so long for the vaccine to work to actually have the impact.
What we need to do in Michigan is shut things down. If we tried to vaccinate our way out of what's happening in Michigan, we'd be disappointed that it took so long for the vaccine to work. That's from CDC Director Rochelle Walensky today, coming just one day after Governor Whitmer repeated her plea again for the White House to please surge extra vaccine to her state while they cope with this huge rise in cases. It's interesting. This is now a legit controversy between what the state is asking for from the federal government and what the federal government is willing to give them. And the scientific thinking about whether or not extra vaccines could help. Clearly, there's a disagreement there between the Biden administration, between the White House, and what the state wants. But the White House is sending some additional resources. The White House stressed today that they're surging additional personnel, additional vaccinators to help expand Michigan's vaccine capacity. They're also trying to help expand Michigan's testing capacity. And interestingly, they said they plan to surge treatments, therapeutics, monoclonal antibody treatments to Michigan for people who are COVID positive. The use of those treatments for people who actually contract COVID is something that we've covered pretty intensively here on this show. The clinical data about monoclonal antibody treatments shows that they're really effective if used quickly enough. They're really effective at reducing the risk of hospitalization and death. For people who get COVID, who are at high risk of getting very sick from COVID, including everybody over age 65, people over age 55 with a number of different comorbidities, younger people even if they have serious enough comorbidities. If you're COVID positive and you only have mild or moderate symptoms, if you can get a monoclonal antibody infusion early, before you need to be hospitalized, they've been shown to be incredibly effective at preventing people from getting sick, at saving lives. They're being underutilized. They're free to the end user. The U.S. government has bought these doses, but there just isn't enough awareness that they could be used and that they should be used before people are sick enough that they need to be hospitalized. So we've been talking about that a lot on this show. We've now sort of having a bunch of developments on that front all at once. First of all, we do have the federal government essentially endorsing these treatments today at the White House, saying that, we don't believe that extra vaccine supply in Michigan will make the difference in this spike in cases and spike in hospitalizations there. But treatments to prevent people who have COVID from getting very sick, monoclonal antibody treatments, we will surge those. Interesting. Also, new interesting clinical data today suggesting that these types of treatment might be more useful and potentially ought to be even more accessible than was clear even before today. Regeneron is probably the best known of all of these therapies, one, because it's the easiest to pronounce, also because it's the one that was given to President Trump when he was diagnosed with COVID-19 and he went to Walter Reed. Again, you use this to treat people who have COVID, who are at high risk of getting very sick from it. The infusion happens before you have to be hospitalized. It has to happen early in your infection. But today, Regeneron said that they're going to ask the FDA if their treatment can be used at a broader time. Basically, if it can be used to prevent treatment. According to a phase 3 clinical trial of people who were exposed to the virus, who had a household exposure to the virus, taking Regeneron, taking this drug, actually reduced the risk of getting COVID, getting symptomatic infection by over 80%. The prospect that this could keep you from getting infected if you are exposed to somebody with COVID could be another big major use for these types of drugs. The other sort of exciting top line from this trial is that for the purposes of this trial, they didn't give this drug in an IV infusion. They simply gave it as an injection, as a shot, the same way that you get a vaccine, which is a much easier way to get a drug into people than having to get them in an IV infusion where they have to sit there at an infusion center for an hour while the drug gets slowly dripped into them. All this to say, if this further use for Regeneron gets approved, if the White House endorsement of these therapies as a way to fight surges matters in Michigan and could matter in other states, could that mean something important for our overall fight against this virus and the ongoing fight to save lives? Joining us now is Dr. Vin Gupta. He's a pulmonologist. He's a global health policy expert and affiliate assistant professor at the Institute for Health Metrics and Evaluation. Dr. Gupta, it's really nice of you to make time to be here tonight. Thank you.
Thanks, Rachel, for having me.
So you've been very outspoken about the utility of these monoclonal antibody treatments in the fight against COVID. I want to ask you, as a practitioner, if I said anything there that was wrong about them, or if there's anything else that you think people should understand broadly about how these things could be used and why they should perhaps be used more than they are.
Absolutely. And good to see you, Rachel. What I'll say is, first of all, no, everything you said was exactly correct. One thing I've noticed, I see the end consequence, Rachel, of what happens if we don't use these at scale. I'm an intensive care unit physician. I was just down in Arizona caring for a very different type of ICU than I cared for earlier in Seattle back at the beginning of the pandemic. Younger patients, those with pre-existing conditions on ventilators. And they were not asking for, they didn't know to ask for monoclonal antibodies. So we are definitely underutilizing a therapy that, frankly, because of demand, the lack of demand for it could keep people out of the hospital. That's the key point here, a 70% reduction in hospitalizations and deaths for those who have COVID-19, have mild to moderate symptoms. This could potentially halt progression, halt seeing folks like me in the intensive care unit.
How does it work practically? I feel like we've talked about this a few different times on the show. We've talked about it with Dr. Kessler, who's a scientific advisor to the high-level scientific advisor to the White House COVID response. And I still feel like the thing that comes up when I talk to people about this in my personal life, when I've had source conversations with this, is that people just don't know what to do. Let's say that I'm not 65, but let's say I was 65 and I just found out that I'm COVID positive. If I'm 65, I technically qualify to get this treatment as a potentially high-risk infection. What do I do if I want to access this antibody? If nobody's offered it to me, if my doctor doesn't seem to know what it is, how do I go about pursuing it?
Oh, and this is the inherent tension here. This is a patient-driven exercise, not provider-driven. That's one of the challenges here. There is really no paradigm here that we've dealt with in the past where a patient has to self-screen and then seek out this therapy. And so for all your viewers out there, please go to combatcovid.hhs.gov. If we had time, I'd delineate everything in terms of all the inclusion criteria if you were to meet them, 65 and older. If you have a pre-existing condition and you're 55 and older, if anybody on that's watching has chronic kidney disease, diabetes, or is taking an immunosuppressive medication, you're 12 and older, you would qualify. Go to that website. You'll find the ability to search by zip code for infusion centers. For those of you in Southeast Michigan watching this right now, I just used the website to see if there are therapies available there. The government and HHS, Dr. Kessler's outfit, is actually actively verifying that hospitals, especially in hot zones, have supply if the website has it. That was a big issue early on, even a few weeks ago, Rachel, where we direct people to that website. Turns out it'd be really actually hard to access it because those hospitals didn't have it. So they're working on that. So if it says the green check mark verified on that website at places, infusion centers that have been identified, call them and you can get a prescription, go in and get your therapy. But this is a challenge because we're asking the same healthcare systems that are trying to vaccinate and test Americans to then also provide a part of their clinics to infuse patients with monoclonal antibodies. So So definitely a challenge.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.